Hi, good morning, everyone. Thanks for joining us. We're going to be starting shortly. We just have Chima Mbakwem is just trying to boot up his system right now. So we just want to give him a few minutes to get his computer system up and running. And then we'll begin. Hi, Chima, just let us know when you're ready.
I can start answering questions, just that my computer is just coming on. I think something just tripped it off. So it's coming on, but I can use this until I get on.
Okay.
All right, I'm ready.
Okay, all right. Well, thank you and good morning again, everyone. Happy Friday to you all. And thank you again for joining us on such short notice again. It seems to be a going trend. This morning, we are doing a press conference on vaccinations. So I just want to introduce to you our featured guests. We have with us joining is our interim chief medical officer, Dr. Robert Leon Guerrero. Hafa Dr. Bob. We also have our Chief Public Health Officer, Chima Mbakwem. And also with us is a local pediatrician and member of the Physicians Advisory Group, Dr. Mike. So as you know, unfortunately, we weren't able to do data with Dr. Ann. And so what we're offering today is a press briefing on vaccinations. This week, we launched our rollout campaign for the pediatric COVID-19 vaccinations, which I think we can all agree has been successful so far. And so what we want to do is just feature some of our local pediatricians as well as Mr. Mbakwem. And they're here to just offer some of the insights on vaccination so far, as well as answer some of the questions that you may have. So I'm going to go ahead and turn over the floor to Chima, who just has some information about vaccinations this week and so far, and hopefully he doesn't get cut off in between trying to switch from his Zoom interfaces. So Chima, if you're ready, you can go ahead. I'm sorry, before you do that, I forgot to mention, after he does his short presentation, we'll go ahead and go to our question and answer portion, one round. If you can go ahead and in the chat box, just list your name and the media organization that you represent. Thank you.
Good morning, everyone. Like Janella said, I just wanted to let you know that we've already started the kids vaccine 5 to 11, and we've seen some encouraging numbers considering the fact that we just launched. And we're hoping that we're going to have more people come out as we open more clinics. Already, we've actually opened the clinic at UOG. The northern and southern regional clinics have extended hours that will accommodate students and kids 5 to 11 from 10 in the morning to 6 p.m. so that they can get their boosters, their vaccines while we continue to plan for the big events. Thank you.
Thank you, Chima. And I'll also give Dr. Bob Leon Guerrero the floor, but Dr. Bob, if you want to add anything or say anything. Dr. Bob, you're on mute. I'm not sure if you're saying anything.
So I agree with Chima, what he says, and we're happy that we're able to give the vaccines to the 5 to 11-year-old. And hopefully with this events, we may be able to open up even more, including having a better Christmas this year than we did last year. Thank you.
Thank you, Dr. Bob. And then Dr. I'm not sure if you have anything to add, but I'll go ahead and give the floor to you, perhaps, from your private practice, if you're getting any questions or concerns from parents or children.
Yeah, nothing super insightful to add. Most of my parents in my clinic have been really excited about the vaccine coming out and have been asking me when it'll be coming to my clinic. One good question I had from a parent was, if my kid had already had COVID, can I get the vaccine or should I get the vaccine? Right now, the recommendation is, yeah, you should still get the vaccine. I do tell parents, and because they bring it up, like, aren't we protected for a while after we get infected? And it does seem like for at least 90 days after a COVID infection, the chance of reinfection is very low. And so parents that decide they want to wait out the 90 days before they get the vaccine, I really don't have a problem with that. And yeah, that's the biggest question I've gotten so far.
Thank you, Dr. So again, that was our brief. I mentioned it would be brief. So I'm going to go ahead and turn over the floor to our media partners. So I'll begin with Polly Suba from K57.
Can anybody talk on the fact that the military has basically said that there's no mask mandate on base establishments, except for medical facilities and Department of Defense education activity schools? And how does that, it doesn't align with the local government's mask mandate anymore?
I'll just mention that if you go back to the guidance, they were actually mentioned that the mask, no mask mandate will be on base, but they also put a caveat that outside the base, they'll follow existing local laws. So I think the guidance was clear about how they interact when they leave the base.
So you don't see that it could possibly be an issue, though, just when now we're vaccinated and unvaccinated is just, you're 2 times as likely if you're unvaccinated to get COVID. And so I remember a time where it was 8 times more likely to get COVID, unvaccinated versus vaccinated. So vaccinated still can pass on COVID. So the local government doesn't see an issue here that the federal government is doing this on the same island?
On the issue of the local government and the federal government, and I think I will not be the right person to answer that. But from a public health perspective, if you're saying that the non-mask wearing mandate will increase transmission on base, but I think if you still make reference to the guidance, it clearly states that they should continue to do social distancing and also wear masks where applicable, and then also follow local laws. So I think that would show that the local laws are being followed when they are off base, to make sure they're in line with what requirements are for us here. So thank you.
Understood. And then if anybody can talk on the at the very end of the last JIC report, it says, although there is a decrease in both the vaccinated and unvaccinated cases rate, DPHSS stated that the risk of being unvaccinated continues to be 2 times more than the vaccinated. Like I said before, I've heard DPHSS say at least 8 times more at one point. Now it's down only to 2 times more.
So if you're looking at the local transmission rate, it will also let you know the drivers for such statements. But what is clear is that if you are vaccinated, there's still a chance that you can be infected. But the chances of being hospitalized and having severe illness is reduced. So that's why we continue to promote, the public health recommendations for continued vigilance, against transmission. So that being said, we are having a reduced number of cases in the community. The vaccine is here to protect us, but at the same time, it does not give you that 100% guarantee that you will not be infected. But when you're infected, there's less severity and less hospitalization. Thank you.
Thank you for the time.
Thank you, Pauline. Joe Taitano with PDN.
Morning, everybody. I'm just wondering how positive has the rollout been so far? And along with that, I know that we have 7,500 initial doses. How many of those do we still have been used already? And how long are we looking at them lasting?
Okay, I can speak on the encouraging numbers that we have already. As at the 10th, which was as at today on the 10th, we already have 567 individuals that have been vaccinated. And this is considering the fact that the vaccination clinics started not a long time ago. Like I think it started, Wednesday. And then remember that the students are still having face-to-face. So there's limited time for them to come out to get vaccinated. This can only happen after school hours, or if they visit their private clinics or visit the community health centers, that open by 10 a.m. in the morning. But public health is planning a big event that will be over the weekend that would accommodate, parents and students and will not interfere with face-to-face. We're also working with DOE, for that big event. The clinics that we have now, using the private providers, using the community health centers and UOG is having multiple clinics open for individuals who can at this time, without interfering with face-to-face classes for the kids, get vaccinated. And then for the numbers, we already used less than 600 of the doses that we have, but the more we use, the more we can order. So the vaccines are there for us to order, but right now there's a cap for 7,500, but as we use them up, we can order. Thank you.
I'd just like to add that when we first started giving the vaccinations, initially we were kind of worried about giving too much vaccinations at one time and then running out at the end. We've since learned that if we give it all out as soon as we can, that the federal government will then add more vaccines to the program. So although we only got 7,500 in the initial period, we've already ordered for some more, so that my guess is before the end of the month, we'll get another shipment to help get the second dose in and also get the first dose for other students. Thank you.
And Dr. Bob, I know before we were kind of talking about having a phased rollout. It doesn't, I think as early as last week, so it doesn't look like that's the case anymore. Is that just because we think there's enough in the supply to accommodate everybody?
I believe so. Obviously, we like to have all the 5 to 11-year-olds get vaccinated, but reality is that some parents are going to be hesitant about getting the vaccines, and so they may, there's going to be a certain percentage of 5 to 11-year-olds that won't receive it, and so the big events that Chima was alluding to is that sometime next week we're going to have 3 vaccination sites, one at Ugadu, one at Tidron, and probably one at FD to accommodate as many students as possible on the weekends. And hopefully we'll see more. And I think we're also doing a lot of PSAs. Dr. Did one, and they're going to try to do one with the other pediatricians to try to encourage their patients to get the vaccine. That it's fairly safe, and that getting the vaccine will help us get out of this predicament a lot sooner than later. Thank you.
And are we still shooting for, I think it was the 20th, so next Saturday, as far as that over the weekend big vaccine clinic at the schools?
I'm currently off island, so I didn't attend the last meeting. So I believe that that's still the 20th. We were trying to do it the 13th, but schools asked us because to try to get the logistics, it would be much better to do it on the 20th. So yes, I think it's the 20th still.
And also, to support what Dr. Bob is saying, while we're still planning for these big events, we actually have weekend clinics at UOG. We have weekend clinics at the north and the south, to accommodate parents. And the reason being that, weekends will be a lot better for parents who would want to take their kids to go get vaccinated. It's less disruptive. They don't have to take them out of school, and it's a weekend so that they can bring their kids, as a family to come get vaccinated. So we're looking at the big event on the 20th, but remember that the UOG also has the capacity to do almost 2,000 vaccines a day. And then also for the public health community health centers, also have the capacity to support a number of vaccines. At least we've been able to push up to 500. So that being said, if we see a huge number of people come out this weekend, these few weekends that we're going to have these clinics before we have the big clinic, you're going to see a huge number of the kids 5 to 11 vaccinated. Thank you.
And real quick, one last question. Now that we have, I know it's real early in terms of the availability of vaccines for some of the kids, but now that we have the ability to vaccinate some of the younger kids, is that going to affect at all the whether we look at policy for the schools, or maybe going to be able to, open up a little bit more and allow more interaction between students in the future, or face-to-face learning?
Yes, I think everything we do is dependent on what we have and what the science says. Right now we have the layered approach for prevention, which actually has helped us to open the school. And then with the vaccines, if there are going to be policy changes, that will be from the results of what we see from the vaccines, which I know is very encouraging because the kids will have another layer of protection, which will make it more easier for us to continue face-to-face. We're already doing face-to-face. So I think with the vaccines, the parents will be a little more encouraged and, have rest of mind that the kids are protected. And that would also, alleviate that stress, within the community that the age that we were worried about, that could not be vaccinated is being vaccinated now. So I think moving forward, the policy changes will come with the results of what we're doing now. Thank you.
Thank you, Joe. We'll go to Daniel
All right,
Perez.
thank you.
Thank you. Daniel Perez with KUAM.
Yes, hi, good morning, everybody. Dr. Bob, Dr. So I don't know who can answer this question, but is there anything new with the CDC team that's on island?
Like I mentioned earlier, the CDC team here is here to work side by side with the Department of Public Health to look at those cases that we had, and it's just not a one-time event. They're going to go through the patient history. They are going to ask questions. This is what we normally do. Is retrospective case investigation. What we just want to do is find out what actually happened, and that will determine how we move forward. So it's ongoing, and when that is done, you will see the results. Thank you.
And I know you mentioned last time that they are planning on working with the all three hospitals on island. Any updates on that?
So also, Daniel, the case investigation between the Division of Public Health and the hospitals and the clinics has been ongoing since. For every reportable disease, when you report to public health, we get in and do a case investigation, not to determine only, but also to find out, how to move forward with such communicable diseases when we get those reports. So, working with the hospitals, yes, we've actually made contact with them, we've met with them, we've discussed, ways moving forward. But like I mentioned earlier, is ongoing, is normal investigation, and the results will be used to change. The results will be used to support whatever we think or whatever we've been seeing. So we just want to make sure that it is not assumptions. So the case investigation will tell us more. Thank you.
Right, and heading back to the kids vaccine, has there been any adverse reactions so far?
None that has been reported to me or to the immunization program.
Yeah, Daniel, we haven't received any reports of adverse reaction that we're aware of, but we always do encourage patients, and in this case, their parents, that if they do have any reports of adverse reactions, to report it to the VAERS system. And also encourage them to register to the VAERS reporting system. But so far, we haven't received or are aware of any adverse reactions being reported to public health.
Right. Thank you so much, everybody.
Thank you, Daniel. Next is Althea Engman from PNC. Hi, Althea, are you there?
Hi, good morning.
Morning.
Sorry, I thought I was unmuted. My question was, when will the data be publicized regarding the vaccination numbers of who got each type of vaccine?
Can you repeat that question again? I didn't hear it. Sorry.
Sorry, I just wanted to know when the data will be publicized regarding the vaccination numbers of who got each type of vaccine.
I think the numbers will be reported the normal way is reported. I think nothing really changed. It's just the kids vaccine that had just been added, and it's still the Pfizer vaccine. So there's no different vaccine for the kids right now. We're using only the Pfizer vaccine. So what will happen is that the number of the age group that has been receiving the vaccine will now include the 5 to 11. So that will be put into the system. The way we normally report all our vaccines.
I have a follow-up question. I'm sorry.
Yeah, so I just wanted to add too that when Dr. Ann does her data analysis on a weekly basis, that is something that she adds in her report. It's through rates. It's not very raw data, but she did mention that in one of her reports.
Thank you. I had a follow-up to that question, or not that question specifically, but it's in regards to data available in regards to false positives and negatives from rapid testing.
What can I understand clearly what you're saying? You're saying, do we have data on false positive?
Yes. So in regards to rapid testing, there have been some things about having false positives and negatives. I wanted to know if there were a number of people reported that is available.
Well, I think there are two things that happen when you do a test. When you perform a test, if it's an antigen test and you have symptoms, you get a second swab to confirm that at that point, even that you have symptoms and you test negative on the antigen test, we run a PCR test for confirmatory. But if it's an antigen test and you have symptoms and if it's positive, then that is a positive. So that's the answer to the question. The issue of false positive and false negative will not come up when, there's a confirmatory result for a negative, but for positive is positive.
Thank you.
Thank you.
Thank you, Althea. Jerry Partita with PNC Digital. Hi, Jerry. Are you there?
Yes, thank you, Janella. Sorry about that. Uh, my question is, can the doctors comment on the latest data released by Public Health? The what do you call that? The surveillance data. Can you comment on the decline in COVID cases, the drop in the CAR score? What factors do you attribute that to? And do you see this trend continuing? And what levels would you consider to would trigger a decision to lift restrictions for the coming holidays? Oh,
You wanna
did you
take
hear me,
that?
guys?
Okay.
Yeah.
So I think the reason why we're, oh,
Oh, go ahead, go ahead.
The question was put to the doctor, so maybe he doesn't want me to answer to the question. So I'll leave it
Dr.
to
Elmer,
him.
Dr. Bob can comment on
Go ahead,
that.
Dr. Bao, you go first.
He
all
was
right. So
specific.
the reason why we're seeing decreased numbers is that we're having more people vaccinated. We're also having, unfortunately, people get sick, and so they now have antibodies at least for the next 3 months. So that's what. So the more people that get vaccinated, the more people that are sick, the less likely somebody will catch the virus, and that's why we're seeing the surge go down. Now, what I learned from this particular virus, the COVID-19, is never assume anything. I actually thought, and it was because the previous strain was not as infective as the Delta variant. So with the amount of vaccinated people and the amount of people that were sick, that caught the COVID-19, if it was still that variant that was previous, we probably hardly see any cases. But then we had this new Delta variant, and all the game changed, the rules changed, and that's why we saw the surge. So will we get another surge? Probably, maybe. I'm not too sure. But if we get another variant that's just as infective as the Delta, we'll probably see, hopefully not as high as before, because like I said, we are getting more and more people vaccinated. Thank you.
Yeah, I would agree with Dr. Bob. It's probably a function of more and more. Guam overall is doing a pretty good job of getting vaccinated compared to a lot of places stateside. That and all the people that have actually gotten the infection. So there's a pretty big group that has some immunity. As far as what's going to be the trigger to lift restrictions, it's just, I can only guess at this point. That's a discussion with a lot of different parties and ultimately the government makes the call. So I'm not sure how my opinion would be very useful in trying to forecast what might be lifting restrictions.
Mr. Chima, can I have your views also?
Oh, thank you. Okay. I think the reduction in cases clearly shows that the community is actually listening to the public health recommendations and also getting vaccinated. So if you look at the public health recommendations of mask wearing, safe distancing, vaccination, it is working. Whatever happened that triggered off the surge is actually tapering off. But moving forward is how do we maintain these low numbers? Is getting more vaccinated, following public health recommendation, and making sure that we do not get ourselves back to where we are. So it is good to see that the numbers are coming down, and the community should be applauded, for really working together with the government and the Department of Public Health and Social Services, together to bring down the surge. That will help our hospitalization rates, and also we're looking at maintaining this, in the nearest future, and then have that smooth sail and come out of this pandemic in one piece. Thank you.
Okay, the flu season is already upon us. What advice can you give the public? How do we distinguish the ordinary flu from COVID? And is it okay to have a flu shot when you've already been vaccinated for COVID?
Perhaps Dr. Or Dr. Bob?
Yeah, that's a doctor question.
Yes, it's okay to get the shot. They're both inactivated vaccines, so you can get it at the same time. You get one before the other, one after the other. That should be fine. As far as distinguishing for flu versus COVID have a couple things that were a little bit interesting when we saw it. We saw loss of taste and smell, not just due to congestion. And so that's something that we typically don't see with flu. Flu, typically, if you have true flu, unmitigated with a vaccine, it'll hit really hard. You can almost pinpoint the hour that you got sick, often accompanied by really severe body aches. Of course, you can get body aches with COVID as well. And really the best way to tell is to get swabbed. So we have rapid flu swabs that can tell you if you have flu. Of course, we have the antigen test for COVID. So I would say if you're concerned, then definitely go see your doctor.
Dr. Bob, did
I
you
agree.
add to that?
Yeah, I agree with Dr. But there are times when it's really hard to distinguish the two of them. So I agree with Dr. in that the best way is just to get tested to see whether you have the flu or whether you have COVID. Thank you.
Thank you.
And one last question. Aside from the big events in the schools next week, right? The big pediatric vaccination events, do you have other plans for the schools? Like utilizing the schools for a daily pediatric vaccinations, since the kids are already in there, right? So is that in the works, or what other plans do you have with the island's public and Catholic schools and private schools?
In response to your questions, so what we've been trying to do is streamline the immunization of everyone into our daily lives. So the big events is to capture the first large number of people that would want to come to get vaccinated. But we have the doctor's clinic, like you mentioned, we have the school nurses, we have the community health centers that can provide vaccine. So if you're looking at the number of kids that we want to vaccinate, with the approach that we're using now, with UOG, like I mentioned, with the dual clinics on the weekend by the CHCs, and then with the big event that is planned, at least we're looking at capturing a huge number of these individuals. But that does not negate the fact that we still have daily clinics within the pediatric clinics, the community health centers that will continue vaccination. So the plan is to continue vaccination. So big event or small event, it is the consistency so that people will know where to go to get vaccinated if they need to get vaccinated. So it is going to be the big events and the daily events that we're having so that people can have access to vaccines anytime they want it. Thank you.
No, what I meant was, will the individual schools be offering pediatric vaccinations on a more regular basis, on a daily basis, in fact?
So like I said, different strategies will be put in place. And I am not in the position to answer for the schools right now, but what I'm trying to explain is that everywhere you can get a vaccine, you will be able to get a vaccine at some time, but the big events are just planned up front to capture the huge number of people. But those that are going to be hesitant, going down the line, we also want to provide opportunities for them to get vaccinated. So the school question, I think, should be something that we also look at, moving forward. But that decision, cannot be solely made by public health.
Okay,
So
thank you.
Thank you.
Thank
Just
you,
want to
Jerry.
add to that,
Oh, go ahead.
that, prior to COVID-19 vaccinations, most places where the kids were getting vaccinated were at their clinics. A lot, parents tend to trust their pediatricians, and so vaccinations were mainly held at the different clinics. I know that FHP, AMC, and SDA are going to be giving it. I know Dr. Um's going to be giving it. The other ones that are smaller clinics, I think, are going to defer to these big events and these having their kids get the vaccines at UOG, the mall, and at the Dededo and Inarohan. But typically, vaccinations were at the clinics, not at schools. I mean, the schools were the ancillary, and I just think that it'll probably be the same like that. It's just that to try to get the ball rolling with the kids getting vaccinated, where they're offering this on the 20th to the different schools to come in and get their vaccines. But once they get the majority of the kids vaccinated, then they'll probably just continue to get it at where they're more comfortable getting it. Thank you.
Thank you.
Thanks, Jerry. Oya Nirarikwa with Guam Daily Post.
Good morning, everyone. Thanks, everyone, for your time again. I know you guys are busy, so we do appreciate you guys taking time out to answer our questions. My first question is fairly simple. I think I'd just like to know, how many children are we estimated to have in the 5 to 11 age range?
Based on the school data that we just released, I think there's roughly about 18,000 5 to 11-year-olds in the school system. And then there's probably some that are not within the schools, but roughly about 18,000.
Okay. And Doc, what's the goal? We know that not everybody is going to not all 5 to 11-year-olds are going to get vaccinated, but what would make you comfortable, at DPHSS in terms of, this is kind of fairly enough. I mean, we had, as a community, when we were looking at adults, we had I think it was about 75% was sort of our goal. Is there a similar goal for 5 to 11-year-olds?
Well, I don't know as of yet what the actual number or the percentage of people getting vaccinated would help with the community immunity, or what they used to call the herd immunity. I just know that I can give you data on different other diseases, and I can give you an example like the measles. When you have a vaccination rate of 92 to 95%, the risk of getting the measles outbreak is fairly small. Let's see, Samoa in 2019 had 83 kids die from the measles when their vaccination rate dropped from 95 to about 35%. Whereas a few hundred miles away, American Samoa, which is same ethnic background, same type of diseases occurring, they only had 2, and that's because their vaccination rate remained above 92%. I don't know what that number is with the COVID, but the more people that get vaccinated, the closer we get to that number. And I think maybe in hindsight, maybe in a year or two, they'll probably say, oh yeah, we need to continue getting a rate of 92 or 90% vaccinated. Now that 70% was based on the infectivity of the previous strain. With this Delta variant, it was much more infectious, and so that 70% was a number that was and it proved that it was a number that was it was better than 0, obviously, but we probably needed to get more people vaccinated. If we had gotten more people vaccinated, we probably may not have had the surge like the rest of the country. Thank you.
Thanks. And I know that part of the plan is to work with schools. And I think earlier on, there was discussion about some kind of a survey to go out to see how many parents are willing to get their younger children vaccinated. Do we have an idea of those numbers?
We don't have Yeah, we're still working on that survey, Oya. So on DPHSS's end, we are still finalizing the survey so that we can provide that to GDOE, and then they can help us with facilitating that survey out to parents.
But oh yeah, the good news is that while we're still working with the survey, we've seen an increased number of parents who are coming out to get their kids vaccinated. And if you also listen to the interviews, you'll hear parents saying that their kids are actually waiting to get that protection. And then going back to your question to Dr. Bob about percentages, I think with vaccine preventable diseases, we shouldn't be looking at just percentage of the population that has been vaccinated as just a simple way to protect the ones who cannot vaccinate. But looking at it from the point of vaccinating an individual to give them that protection if they can have the vaccination that they need to protect themselves. And this is in reference to what is happening today. CDC actually announced that 22 million babies missed their vaccinations because of COVID. And this is a new and emerging threat for measles. So if you're looking at vaccine preventable diseases, it is important that whoever is capable of getting the vaccination should get the vaccination for that protection. So let's just not look at numbers, but work as a community to get anyone who is able to get the vaccine so that the individual will be protected. Thank you.
Okay. And so speaking of protecting individuals, can we talk real quick about the booster shots and how that effort is going?
The booster clinics are still ongoing. We have booster clinics today. And what is happening, like Dr. Bob was trying to explain, is that we have this going side by side. So we have the 5 to 11, which is the new addition to the vaccines. We already have those who completed their series and are coming out for their boosters. We have those who are unvaccinated that are also being encouraged to come out to get vaccinated. So the vaccination program is ongoing. So we're encouraging anyone, if you've not been vaccinated, come out and get vaccinated. If you've been vaccinated, come out and get your booster shots. If you're 5 to 11, please, we're encouraging you to come out to get vaccinated. So the whole vaccination series is still ongoing. And if you look at the flyers that we put out there, we still have those campaigns going on. So if you go to UOG, you can get your booster, you can get your 5 to 11 shots. If you need a new shot, you can get a new, if you've not had your vaccine, you can get your vaccination. This is also ongoing in other different points of vaccination, across the island. So we continue to encourage vaccination to help us, protect our community and come out of this pandemic. Thank you.
Is there a concern, Chima, with respect to the boosters? And I know that the effort is ongoing, but is there a concern that if not enough people get the booster shots, then we might see a surge as you guys have been talking about?
Sorry, Oya, I just need to excuse Dr. He does have to go. He is in clinic and he has to see patients. So I just wanted to thank you, Dr. for your time.
Thank you, Dr. You were great yesterday, by the way.
Oh, thanks. Thanks for having me on again, Janelle. Bye, guys. Have a good conference.
Go ahead. Sorry about that.
No worries. Do you need me to repeat the question?
Please.
Okay. So looking at our booster numbers, and they haven't been as optimistic as some of the other numbers. Is that a concern for DPHSS?
Well, getting the people that.
Go ahead, Doc. Go ahead.
Getting the people vaccinated with the booster shots is always a concern that we don't reach everybody. But the fact that we're opening it up to the 5 to 11-year-olds, and what we're actually seeing is not only are the 5 and 11-year-olds are getting the vaccines, the parents who were waiting for their kids to get vaccinated are also getting vaccinated. So the more people that get vaccinated, the less likely it'll be the disease can be spreadable. The boosters, most people will be fine without the boosters, but that's, you know, the real young, not the elderly, but if you get more of the young people immunized, it will be sort of like a cocoon. If they don't get it, they don't spread it to their parents, or they don't spread it to their grandparents, especially. So yes, we're concerned, but we're happy that we're giving more people are getting vaccinated, which means that less likely for this pandemic to continue as the way it was before. Thank you.
Doc, and we're seeing more 18-year-olds, people, basically people who are in the working out in the community, going to schools. Those are sort of the numbers that are driving the numbers that we're seeing today, or those age groups, excuse me, are driving those numbers. Are we seeing more of those groups going out to get the booster shots if needed? I think, and I ask that question because if they're the ones who are driving it, and Chima has said this a few times, is if there is, you know, with every transmission, there is a possibility of a new variant emerging. You know, is there any specific sort of campaign or message that you have for those folks in particular, who were already the more hesitant, right? When we saw vaccinations roll out last year, they were the more hesitant age groups. It was, you know, primarily the 60-year-olds and over who were the first. And I think when it opened up to 16-year-olds, parents, you know, were lining up. It was essentially the working group age groups who were the most hesitant, and they're the ones who are driving and continue to drive, it seems like, the high COVID or the COVID numbers.
Well, I don't know. I mean, when I see patients at public health, and I'm pretty sure the other pediatricians, when they see their patients, they try to impress on the parents who are in that age range to get vaccinated. Not so much as a problem, because let's face it, most people that age, when they get sick, they don't really get that. They don't get hospitalized, although some do. They don't die from the disease, although some do. Is that we're trying to protect not just them, but the people that can't get vaccinated, or the elderly who got vaccinated but maybe have waning immunity. So the question I ask to them is that if you love your parents, if you love your grandparents, what's the best thing to do? And that's to protect them. And they invariably respond by saying, get vaccinated. So we're trying to do it at the lower levels, at the clinics. Talk to these parents and about trying to get immunized. Obviously, we're not 100% effective because we're still seeing elderly still not getting vaccinated. So I'm at loss on how to increase that vaccination rate for the elderly, because they're at the most risk to getting hospitalized. They're at the most risk of dying from this disease. But I counsel my parents to say the best way to protect, because we're still not giving 2-year-olds, 3-year-olds, and some of those are still getting admitted to the hospitals. It's the best way to protect them is, I mean, I turn the question to them. It's just, what do you think is the best way to protect your family from getting the COVID? And they invariably say to get vaccinated. But as a campaign, I'm not too sure if there's any, what's the campaign going to be about? Thank you.
Thank you, Doc.
Thank you. Thank you, Oya. So any other questions from our media?
I've got a real quick one. It'll save me from calling you folks and bugging you later.
Sure.
Yeah, so there's currently a federal vaxxer test mandate, which affects millions of Americans. I don't think it actually goes into effect until January. But OSHA, this is more of a policy question maybe for Chima or Janella. But OSHA issued its emergency temporary standard regarding that policy. And one of the things that's available for people who want to test, who have to get tested weekly, is an over-the-counter test that's proctored by either an employer or telehealth provider. And I'm wondering if there's any thought given to that. You know, we got a lot of people locally who are covered by the vaxxer test mandates. I don't know how many people there are, but is there any thought to maybe providing that as an option here on Guam for the local vaxxer test mandates?
Okay, I think I hope the director is not listening to this. It's on my table, you know, and he's actually, you know, actually asked me to get the policy ready, you know, to be issued, and also the chief of staff and the lieutenant governor discussed this last week. It's been on the table, you know, to have the over-the-counter test. But what you should understand is that over-the-counter test is okay for anyone to use because it has manufacturers' directions on how to use it. But the challenge will be the reporting part of it. You know, so if you test positive, what do you need to do? If you test negative, what do you need to do? So that is the part that I've actually been discussing with the team, because the government and the Division of Public Health would not stop anyone who wants to do the over-the-counter test, which is actually EUA and FDA approved, but is how to report to public health those who turn positive. So you're going to be seeing a policy statement out soon, you know, on what public health expects from people who, you know, do the over-the-counter test. So like pregnancy test, there's no control over the counter pregnancy test. You know, you can go buy it and get tested for pregnancy, you know, but reporting to your medical provider or reporting to public health, you know, so that we can support case investigation or make sure that there is no ongoing spread, you know, from that positive case. And hopefully we're going to rely on the individual to do self-reporting, you know, to us. Because if you go to a medical clinic or a hospital to go get tested for COVID, by law, you know, is a reportable disease to public health. So they report to us. And that is how we initiate contact investigation and contact tracing. But if you're going to do it in the comfort of your home, we also hope that, you know, the individual will report to public health so that we can put all the mechanism in place to make sure there's no ongoing transmission. So thank you for the question, and please be on the lookout for our position on this soon.
And is that going to be, are people going to be able to take the test at home, or is that also going to be the same thing where they have to take it in front of their employer?
For the policy for using it as the vaccine or test, I don't think I can discuss that now, but what I'm discussing generally is, you know, the use of the home test kits. That decision will have to be made by the Department of Administration, you know, on how they want to go ahead with that. I think it's a policy of DOA, not the Division of Public Health.
And along those lines, sounds like this is maybe regarding more GovOne, but along those lines, are we gonna, I know Public Health does provide free tests to some local businesses that have to test weekly, or is that also gonna be the case? Not sure if you can answer right now.
Yes, I cannot answer. I didn't even get the early part of your question, so that's why I was training. Yes.
Oh, I'm sorry. I know that Public Health does provide kind of a free test to some local businesses. Is that also going to be something that we see more? Maybe just, you know, over-the-counter antigen tests made available for people that have to test weekly?
Yeah, so those decisions I cannot make them right now, you know, because we work as a team. So decisions are made, you know, with the team. So I will not be in the position to answer that question right now.
Okay, all right. Appreciate it, Chima. I hope I didn't get you in hot water or anything. Thank you.
No, you know, like the director is a very, very proactive. You know, he actually asked us to do this, and we've been doing it. So that's why I said I hope he's not listening, because he actually mentioned it to us. He's followed up on us, and you know, we really make sure that we think ahead. So we've actually discussed in details. We've actually worked it out, but it's just for me to present it to him, you know, and then for his final review before we set it out there. But he's actually mentioned it. We've discussed in details because it's something we need to do. It's something that, you know, it's important that people know their status, you know, if they want to know and if it's available for them to know. But like I said, the challenge is how do we know, you know, when you test positive, you know, and we hope individuals will be able to come forward and, you know, let us know. Thank you.
Thank you very
Joe.
much.
Chima never gets in trouble, but anyway. All right, I'm just kidding. Any other questions from our media partners? Okay, all right. Well, that concludes our press briefing this week. Again, thank you to all our media partners for joining us on short notice again. Thank you to Dr. Bob and Chima as well for being here today. If no other questions, or if you have any other follow-up questions, you can always reach me and send me your questions and I'll do my best to get you those answers. That'll do it for our press conference. Enjoy the rest of your week. Please be safe and enjoy your weekend rather. Well, have a good weekend, everyone. Take care.